Welcome to our first video of CNO on the go. I'm going to spend some time here today at Schuylkill on 5 North, which is one of their amazing med-surg units. And I've been shadowing over the last several months at different units throughout our entire network, and I thought, well, this time I want to share what I learned with everyone. So as I shadow today here on 5 North, we're going to talk to some of the team, learn what they do here, learn the amazing work that they do, and share that with all of you. So I'm here with Jordan today on 5 North at Schuylkill Hospital. We just spent some time shadowing. I got to see all the amazing things they do, learned a lot about the patients they take care of, and the outcomes that they're achieving for their patients. So we're just gonna take a little walk around and show everybody what I got to see. Right? Even though this is a little bit of an older hospital, I'll say the one thing that always stands out to me when I come here is you could eat off the floor. It is so sparkly clean. They have an amazing EVS team. And the other thing that I always hear compliments about, and you can tell me if this is true or not, is the dietary department. That we get a lot of compliments that the cafeteria is actually really good. Do you guys find that, or?
Yeah, I find it mixed.
Yeah.
Some people are, they really love it, and some people I think maybe just are a little bit more picky with their food, but for the most part, yep.
Okay. What kind of patients do you usually take care of on this floor?
So I take care of a lot of ortho patients. Those are the big surgical patients that we have on this floor, although we take care of a number of surgical patients. And I take care of a lot of patients with chronic illnesses if they have exacerbations of that. We'll have stroke patients, and then we'll have cardiac patients as well who need telemetry.
Okay. What do you think? I know that we talked a little bit about this earlier, but I think it's important to share this. What do you think is the best thing about working on this unit?
Is all of my coworkers.
Yeah.
We really are a very close-knit group of people. We hang out a lot outside of work. We get along very well on the floor, and I always feel comfortable with the people that I'm working with.
Yeah, Jordan gave me an example of one day she had 3 patients that were she was struggling with because they were having medical issues all at the same time, and all of her team just jumped in to help. I mean, that's the kind of teamwork that you need on a unit when you're working under stressful conditions. So I really think this is an awesome team for that. So we're gonna keep on going, if that's okay. We're going to walk and see some of the rest of the unit.
Hi, my name is Tiffany. I'm the Director of Clinical Services here on 5 North at Lehigh Valley Schuylkill. We are currently working on some great things here at Schuylkill. On 5 North, we're really working on our customer service initiatives for the environment.
So, is this your new board?
Yes, this is where we do some sort of sometimes Tiffany will post what a patient says specifically about a nurse or their experience here.
Okay. So yeah, we just redesigning some of the boards around the network, and definitely here at Schuylkill Hospital to do safety huddles and kind of recognize some of our teams. So I knew they do a lot of team recognition here. I know there's nothing on the board. Looks like they just cleaned it for today. So what are some of the challenges that you guys have? Like, what are some of the things that we struggle with here?
I would say it depends on the acuity of the patients that you have and maybe the number of the patients you have. It varies a lot, but for the most part, I feel like even when I do have a high acuity patient, because we all are very close and understand each other and want to take care of each other as coworkers, that everyone kind of helps and steps up, and
that's great.
I never feel like I'm just on my own and no one's here to help me.
That's awesome. It makes all the difference in the world. Is there anything about like supplies or equipment that we struggle with, or do you feel like you have all the stuff that you need?
No, I think they've made some pretty good updates with equipment and having enough things and having them readily available to us. So usually when it comes to that, supplies and equipment, I don't feel like we're behind and we don't have things that other hospitals don't have.
Okay, good. If you could have your wish and have anything in the world that you wanted to make this unit better, what would you have?
More nurses.
More nurses. Okay.
Hi, my name is Megan. I'm the Patient Care Manager here on 5 North at Lehigh Valley Schuylkill. I think the thing I'm most proud about of our unit is our teamwork. I've been here just about a year, and honestly, the girls here welcome me with open arms, and I know they make all of our patients and coworkers feel that way as well.
Is there any last things you would like everyone to know, and specifically about Schuylkill, even just the hospital, not specifically your unit?
I think we're a pretty great small community hospital.
Yeah.
I think sometimes patients come in and I think that they think that we are, like a sister hospital like Cedar Crest, and we're
going to have the same.
Can take care of everything possible, but I think for the most part, we do the best we can. And I think as a whole, the community's pretty happy with the care that we give here.
Yeah, I've only heard amazing things and really good care. Great. Well, thank you for spending time with me today. I really appreciate it. And thank you guys for being with us.